Well, let's take a look at it, because for patients in Gaza whose injuries or illnesses cannot be treated locally, evacuation abroad can mean the difference, of course, between life and death. But getting out, as we've been hearing, takes time and it's tightly controlled. It starts with a doctor in Gaza. If treatment is not available, the patient's name is put on a list for medical treatment and transfer abroad. The referral is formally lodged at a public hospital, and from there, the case enters Gaza's medical evacuation system. Hospitals then forward names to a central medical body, and a referral committee team then reviews every case. Patients are ranked by medical need. Approved cases are then passed to the World Health Organization, the main coordinator moving forward. The WHO then approaches countries willing to admit patients for treatment, and it also contacts patients and their family members to confirm identities, medical details, and to arrange paperwork. Finally, the names are submitted to Israel for security clearance, and once approved, the WHO coordinates the evacuation. Even as some patients are being transferred out of Gaza, the reopening of the Rafah crossing has come too late for many others. In Qudri has this report now from Gaza City.
Ibtisam Abu Ameera was just 3 years old. She died while waiting for the Rafah crossing to open. No one ever knew what illness she had. Gaza's laboratories lacked the tools and tests needed to diagnose her condition. Days after her medical evacuation papers were finally approved, Ibtisam died.
My daughter died 3 months ago, and until today I don't know what was wrong with her. Her medical evacuation papers were ready, but she died before she could travel. We couldn't save her life because the Rafah crossing was closed. Israel was isolating Gaza, blocking everything, medicine and lab tests.
Her mother Aisha still cries every day, holding Ibtisam's clothes a strand of her hair, grieving a child she could not save. Like hundreds of other parents in Gaza, she watched her child die, trapped by movement restrictions imposed on the Strip. Since Rafah closed, at least 1,268 Palestinians have died in Gaza, waiting for medical evacuation. 20,000 people have medical referrals and are currently waiting for permission to travel for treatment. Israel has said it will allow 50 patients per day to leave Gaza, accompanied by 2 relatives. At this rate, it would take more than a year to clear the current backlog. That's a year many patients don't have.
In the corridors of Gaza's hospitals, patients lie waiting, many of them knowing this may be their last chance. The Rafah crossing is reopening, but only for a limited number each day, which means many of those who are critically ill could be left behind. For many here, the delay could be fatal.
We lost many of our patients and children during this genocide because they were prevented from traveling for treatment abroad. We hear the crossing will reopen, and we hope we don't lose more lives.
I waited for the crossing to open, but my daughter died before this day came. There's no justification for denying any patient medical treatment. My daughter died when she was only 3 years old. She didn't live at all.
Hind al-Khudri, Al Jazeera, Gaza, Palestine.
Don't miss out. Get the full picture. Subscribe to Al Jazeera for reliable news, expert insight. Like, share, stay ahead.